All right, so we'll continue here with the skeletal system, talking about specifically about the vertebral column now, or the backbone. Sometimes it's called the spine. You know all the words for this sort of thing. The backbone consists of 26 irregular bones, so they don't have a regular shape. They're really oddly shaped, as you can see there in that picture. And they are connected in such a way that it allows for flexibility and it allows for curvature. Curvature is an important thing. Notice how you can see in this picture how the backbone is curved. This allows for resilience and flexibility of the spine. It functions kind of like a spring. If it was straight, it would be very rigid and inflexible, and so this allows it to have this springy quality, which gives it lots of flexibility and resistance. So a couple things. Let's look at these sections here, and you can see some of the terminology that we're going to look at. The different sections that we're going to look at, they're divided into 5 different sections. The first one is the cervical vertebra. There are 7 cervical vertebrae, and they're usually numbered 1 to 7, or in this case, or 1 to 12, or depending on how many there are. And it goes from the top to the bottom. And the cervical vertebrae are concave posteriorly, and what that means is toward the posterior, they're concave, which means they're caved in, and convex is the other, which means they protrude out. You see that on the thoracic curvature, which we'll get to in a second. A couple things in particular about the cervical vertebra that I want to make comment on are C1 and C2. C1 is known as the atlas, and you can see that there. The atlas allows for the rotation of the head, it allows for the nodding of the head, like your head going back, forward, and backwards. And its job is to articulate directly with the skull. And so it gets the term atlas because of the mythological person that held up the earth. This is holding up your head, the atlas is. The axis, or C2, allows for the rotation of the head, and so that you get the term axis rotation. Fair enough. All right, next is the thoracic curvature, the thoracic vertebra. There are 12 of them, and they have that opposite curvature, that convex curvature for there. And their claim to fame is that they articulate directly with the ribs. The lumbar curvature, the lumbar vertebra, they are concave, so they go the opposite. There are 5 lumbar vertebrae. This constitutes your lower back. The sacrum, or the sacral curvature, there are 5 vertebrae there, and notice these vertebrae are fused, and that means that you can't undo them. They're stuck together, and this articulates with the pelvis, or your hip bone. And then lastly is the coccyx, and the coccyx is 4 fused vertebrae. This is your tailbone, largely a vestigial structure. Vestigial meaning that it's no longer a functional thing. We don't have tails. There's some function there. It does kind of cradle some of the pelvic organs and whatnot, but for the most part, no function. That's that. All right, so there's vertebra. So let's look at the particulars of an individual vertebra. They are all going to be different depending on where you find them on the backbone, but in general, there are some common anatomy. The first is the body here. The body is the weight-bearing portion of the vertebra, and each of those body sections are going to be separated by these discs, and we'll get to that in a second. There's the vertebral arch, and you can see the vertebral arch there, and each one of them have that, and it creates this structure called the vertebral foramen, and the foramen is where the spinal cord passes through. And so if you're looking at, well, it just shows you here, there's posterior towards the back and anterior towards the stomach. And so if you were to touch your backbone through your stomach, you would be touching this, and touching your backbone from your back, you're touching this side. There's the spinous process. That's like the actual spine, what we typically think of as the spine, when you can see these spinous processes sticking out there. And then there are the transverse processes. You have 2 of those sticking out on either side. There are several ligaments that keep you upright and keep your backbone flexible yet sturdy. And these ligaments go up and down the length of the backbone, and they, along with your trunk muscles like your abs and whatnot, keep you upright. And so a couple of the major ligaments to look at first is the anterior longitudinal and the posterior longitudinal ligaments. They tell you where they are. So the anterior ligament is located on the anterior aspect, and it is this wide, strong band, and it prevents you from bending too far back. And so it is much stronger because it has to resist more force. If you think about trying to bend your back a certain way, you can't really go back for so far. Whereas the posterior ligament, you can see here in this picture, shows it as a really thin band up there, and it keeps you from bending too far forward, which we do need to bend over a certain amount and to do things. And so then that allows us that type of maneuvering. And then you have the ligamentum flavum, and these connect the adjacent vertebra together, which you can see there, and they're made of very strong elastic tissue, so they're constantly having to go to stretch out and then go back into their original shape, because this allows your backbone to be flexible in several different directions. And that moves us to the intervertebral discs, and you see these called a lot of different things. Someone says that they slipped a disc. This is what they're talking about. And these are the individual cartilages in between each disc. And this is the body. This is vertebral body, and the vertebral body of the next one. And this is that disc that sits in between them. It acts like a cushion between each of them, and it is made up of two parts, and you can see them here. The nucleus pulposus, and the nucleus pulposus is like this gelatinous material in the middle, gives that disc elasticity and compressibility. Think of like a tennis ball, has some stretch and has some compressibility to it. And then around that is the annulus fibrosus, which limits the expansion of that nucleus pulposus. So it only allows it to squeeze so much. It kind of acts like a strap binding the vertebra together, keeps it from twisting, keeps the backbone from twisting, gives it some tension as well. And so it keeps all of that nice gel inside there, everything intact, at least if it's healthy. And again, these discs are thickest at the lumbar and cervical regions, giving those regions in particular a lot more flexibility. If you think about your back, your lower back is flexible, your neck is very flexible, but your chest not so much, which makes sense because all the ribs and things that you have there. The discs are approximately 25% of the height of the spine. And what happens as the day goes on and gravity continues to affect your body, you actually shrink as the day goes on a couple of millimeters. And then when you lay down, you kind of stretch back out a little bit. So let's talk about some imbalances that can happen with these discs. The first one is a herniated disc. This is something that you've probably heard about, that slipped disc I mentioned earlier. You see here, this is that nucleus pulposus. There's the annulus disc, and basically what happens when you slip a disc is that middle gel fluid pokes out of that annulus fibrosus, and that's not good, because not only does it, it's not supposed to happen, but it presses on these nerves here. It can press on the spinal cord here, or it can press on these other nerves here, and that can cause a lot of pain. That can cause a lot of numbness. And so typically when this happens is usually some sort of acute injury, maybe associated with lifting a large amount of weight all of a sudden, a jerking kind of motion. And so there's a lot of ways this can happen. It could happen over a protracted amount of time. Maybe if you do manual labor or something like that, eventually these things wear out. And so sometimes they're just corrected through rest, but a lot of times they end up having to be surgically repaired in order to get everything back intact. Now let's look at some abnormal curvatures of the spine. There's a couple that I want to talk about here. There's a couple in here that we won't mention, like we won't talk about lordosis, and we've talked about healthy already. So let's look at scoliosis. Scoliosis is a lateral curvature of the spine, And so what ends up happening here when you're young, people are developing, their muscles are developing. A lot of times, certain muscles of the back don't turn on. And so, or they may take longer to turn on. And so what ends up happening is you have one side of the muscles that are pushing on the back or are causing the back to contract, and the other side that aren't really doing anything. And so you have this uneven kind of working of the back that causes the spine to curve. There are other things that can cause scoliosis, but this is the most common, and it can tend to correct itself later on in childhood and in early adulthood. Severe cases do require surgery. And then there's kyphosis, and this is typically known as hunchback. And what happens here is where you have this dorsally exaggerated thoracic curvature. See, normally you have thoracic curvature is just kind of normal here. Here, the top portion of that bends over too much or flexes too much dorsally. And so what ends up happening is, particularly with older people, we've talked about osteoporosis, we've talked about other things that can affect those ligaments getting tired, getting wore out, and the osteoporosis where the bones are just breaking. And this causes that back to curve down like that. It can also be caused by rickets, which, remember, we talked about that and how the bones don't fully harden, and so they can bend and causing the back to do this. And so it is usually only correctable through wearing a brace or something along those lines. If you catch it early, if you catch it too late, it can be more of a permanent condition.